Hi, welcome from the NCC 2022. I'm here with Nicola Logan. Professor Logan is a professor at the Aston University in the UK, and she is a researcher on multiple levels, but especially also myopia. So welcome at the NCC 2022, beyond 2020. So hopefully you enjoyed it. We're now at the ending of the NCC. So how are you doing?
I'm doing great, Gabi. It's brilliant to be here. It's really quite vibrant and great to see so many people back face to face.
Okay. And I just want to have a question. We did a presentation on the IMI guidelines, and I was wondering, are there some topics that maybe should myopia management be a standard of care for ECPs? What do you think of that?
I think myopia management should be that standard of care for ECPs, across the world. We see with the World Council of Optometry that are kind of mandating that we should be bringing it in, and Canada is one country that has already adopted that.
Okay.
And I think the challenge is that we've got a range of interventions now that can slow down progression of myopia in children. And it's that kind of cost of those and bringing those into our clinical practice that is the current challenge. But I think we need to look more widely at how we can do that.
And if you look at that, because it's important that it will be standard of care, what do you think? There are some small rumors going on that myopia maybe is a chronic progressive disease. And should we name progressive myopia as a disease? Is that something you have an opinion about?
I think myopia kind of fits the criteria, for disease. It's a chronic condition because once you have it, it's not going to go away. I mean, if you have laser surgery, it's going to correct the refractive level, but not the long axial length that goes with it. And it's typically progressive. It starts in childhood, carries on, progressing to late teenage, early 20s. And then can be compounded with complications in later life, and so I think we kind of need to look at that bigger picture and kind of think about it as a disease process rather than just a refractive error problem.
Okay. And now we're talking about we've talked about what's happened in the past, in the present, and if you look at the future for myopia management, do you think that there will be even better options available in the near future for myopia management?
Yeah, I think right now we've got a range of options that give us good effects. We're not at 100% effectivity, whether we've ever reached that or whether that would be able to do so given kind of normal growth in the eye. But I think as we move forward, we're looking for ways that we can kind of maximize or optimize, the impact that those interventions can have, and whether it's through kind of dual interventions or supplementing them with different things. I think that's where that research will be going forward, and perhaps we'll see a more kind of tailored approach to an individual child. What's most appropriate for that individual child, and can we take some additional measures of their eyes that would kind of give us an indication as to what's the optimal treatment for them.
Okay. Thank you for your time. Thank you for being
Gabi.
here. Appreciate it. So we wrap it up with Professor Nicola Logan, and hopefully see you soon.